In this video, I'm going to show you how to make a type 1 PDEK bubble. So these are the instruments which you need for the bubble making. Nothing fancy, just a 5 ml syringe, a 30 gauge cannula, and you need a Teflon block and a couple of forceps and a Vana scissor. So we start off with placing the Teflon block on the reverse side, and you place your conuscleral button over the block. And how do you start off making the bubble is basically you hold the conuscleral rim, angulate the needle in such a way that you enter at a deeper plane just beyond the limbus, and once you cross the limbus you try to take the needle a little anterior, making sure not to cause any micro perforations in the cornea. So once you start injecting the air, you will see this emphysema starting to form. So those are the indications that you are going to get a type 1 bubble. So sometimes you can get the bubble at your first shot. If you don't and you see multiple type 1 bubbles trying to form there, you could retract your needle, try to change the path, go into one of those bubbles into the dome, making sure not to cause any perforations there, and still inject your air, and that is your type 1 bubble. So once you achieve a bubble of adequate size, then what you do is you retract the needle out, you take a 15-degree side port knife, you make a stab incision into the bubble and use your Blurex to stain the graft. The staining at this stage is just to demarcate the edges of the bubble so that when you cut it, it's more visible to you. So there is an air bubble inside, and you can use your Vanas to do a freehand dissection of the graft. So I'm doing a freehand dissection here for my first case. So once I do, I am going to place the graft into the medium again. You have to stain the graft again for visibility, because in these cases we don't stamp the PDEK graft. So the double staining helps me to identify the scroll, because only based on that I'm going to unroll the graft with the help of an endoilluminators to recognize the scroll and unroll the graft inside the patient's eye. I hope this video was useful. So the next video will be talking about different types of bubbles and how do you salvage and try to get a PDEK bubble. Thank you.